Stop doing your hip thrusts wrong. Okay, it's pretty straightforward. Do you know anybody who says it's a good idea to do a butt wink in a squat? No. A butt wink in a squat is a posterior pelvic tilt. Alright, there's your spine, and you go squat, and as you go down, there's your problem. That's a butt wink. Posterior pelvic tilt is associated with lumbar flexion. Lumbar flexion under load is the way we create lower back injuries, lower back disc injuries. And we don't want those, do we? So we don't know anybody who cues do a butt wink when you squat. They wouldn't be that bright, would they? So why do people cue posterior pelvic tilting in a hip thrust? Posterior pelvic tilt is basically butt winking your hip thrust. Let's lay you on your back. Are you ready? Posterior pelvic tilt, everybody. Oh shit. That's right. You're just doing lumbar flexion. I have had an absolute tsunami of girls who are hurting their discs due to hip thrusting and posteriorly pelvic tilting. Now, since we know this is the mechanism of lower back injury, we don't encourage it in any movements. We don't encourage posteriorly pelvic tilting or lumbar flexion under a load. Spines are my life. I've worked for, well, almost 3 decades, over 100,000 patient interactions. I've worked with the greats of spinal work. Personally, Robin McKenzie, who revolutionised disc understanding in the 1960s. The great Professor Stuart McGill, who the most widely published biomechanist in the world, and truly considered to be probably the most understanding person of spines. So I had the good fortune to work with them, and I spend most of my time fixing up really great athletes. So I see things from bikini pros to figure pros to world-class strongmen. Some of the biggest and some of the best and some of the most beautiful. Most of their injuries do relate to movement patterning problems. So when it comes to hip thrusts, it was suggested that doing a posterior pelvic tilt would prevent you from going into anterior pelvic tilt. How about we just stop the whole process and just say, do the damn hip thrust properly. Do it as a hip hinge. Hip hinging, as we know, is the movement pattern that we use to keep spines very healthy. So, anterior pelvic tilt is minimal as a problem compared to posterior pelvic tilt. You cannot bulge a lumbar disc with anterior pelvic tilt, but you do bulge a disc with posterior pelvic tilt. Pretty straightforward, isn't it? So, don't use a bad cue to try and change a bad pattern. How about you just say, don't overextend your lumbar spine, hold a good hip hinge, and don't try and set the world record on a hip thrust because it looks good for Instagram. Okay? Basically, do a perfect movement. Because if you alter the movement pattern, you're not using what you should be using. Loading posterior pelvic tilt into flexion is a terrible idea. So, this is a community service announcement to stop lower back injuries with posterior pelvic tilt and hip thrusting. Stop it. Just do the hip hinge correctly. Interestingly, the wonderful Professor McGill gave an interview on Squat University where he demonstrated this very same point. Let's have a look what the professor says. After all, he's pretty brilliant too.
Descend in the squat, and then your pelvis tucks underneath. Do you see how that creates a stress concentration, usually only at the bottom joint or the lower two? So L4, L5, L5, S1. Those are the most common sites of disc bulges, and this is the mechanism. They descend down, and then the spine, what a weightlifter would call breaks, but that's most of the motion is focused right at that level. That's a real problem. And then pelvic tilt, simulating butt wink. So the pelvic tilt focuses stress right at L5, S1 and L4, L5. The upper back doesn't move. And we did that with 100 pounds on their back for 10 reps. Do you know we had to abandon the study because it was so provocative of back pain?
Wow.
So when I hear people arguing, oh, well, it's okay, really?
So there we have it. The world's greatest spinal specialist, the most published spinal specialist, Professor McGill, and myself. We demonstrate the loading flexion of the lumbar spine, because posterior pelvic tilt produces this, is the mechanism for lower back disc injury, and you don't want one of those. And those who have had them know how bad they can be. And how we can prevent them is by not negotiating on our technique. The best athletes in the world, they don't have poor form. Great athletes I've dealt with, world champions, world record setters, pro athletes, their technique is exemplary. That's why they have long careers. We don't negotiate on technique. Now, spines are what I deal with a lot of the time. This is my area of expertise, as is Professor McGill's. You can't really rationally argue with what Professor McGill has presented to you there. You wouldn't be that bright, would you? No, I mean, you can argue, but probably no one's going to listen to you, and you'll make yourself look like a dickhead. All right, so no more posterior pelvic tilting on your hip thrust. I want to see all these happy, healthy people out there not coming to me with hip thrust injuries from posteriorly pelvic tilting. I want to see people with long, great careers. I want to see the people who I've treated perform beautiful hip hinges, great programming, well performed, and not just trying to set a big weight because it looks good on Instagram. Might look good on Instagram, but I don't want to be having to treat you for lower back injuries afterwards, okay? It's not worth it. Your career's worth it. Your family's worth it. Your life's worth it. Work on that hip hinge, get strong, use great technique, and you'll be fine. No more posterior pelvic tilting, okay, on hip hinging. Stay big, train hard. That's what we do.